As of today, we've moved into a new phase of this crisis.
I am officially declaring a national emergency.
You have to start taking seriously what you can do now, that if and when the infections will come, and they will come.
This is not a drill. We need people to take smart action.
We thank you for joining us for this special edition of WCPO 9 News, Hindsight 2020, the year that changed our lives. I'm Julie O'Neill. It was on this day 1 year ago, the World Health Organization officially declared the coronavirus outbreak a pandemic. 2 days later, then President Donald Trump declared a national emergency and the entire country shut down. In that time, hundreds of thousands of Americans have lost loved ones, been separated from their families, and so many have lost their jobs. Tonight, we take a look back at the year everything changed and where we go from here. This time last year, we had no concept of social distancing, wearing masks in public, or staying home to reduce the spread of a deadly virus. Little did we know the coronavirus outbreak would impact every aspect of our lives. When the pandemic hit, businesses started closing their doors with no idea whether and when they would reopen again. Consumer reporter John Mattery starts our special hour of coverage with a story of perseverance through the lens of two over-the-Rhine businesses.
These new flowers are much more than a sign of spring this year. They're also a sign of hope here on Vine Street in Over the Rhine. It's been 1 year since the COVID-19 shutdown hit this vibrant neighborhood, followed by days of protests in May. It left behind shattered businesses, customers gone, and an uncertain future. Last spring, we visited Tessa Clark, local fashion designer and manager of Idlewild Woman Boutique on Vine Street.
Pushed the product that is, near the front of the store to the back of the store.
Despite all the setbacks, she refused to close.
We're definitely not going to flee to the suburbs.
A year later, that decision to stay may be paying off. The board's now gone. Idlewild Woman's windows are flooded with sunshine, and business is picking up.
We feel hopeful for the future and pretty good about things.
1 year later, you can see the damage the pandemic caused here in OTR. Once popular shops and restaurants like a Tavola have closed their Vine Street locations, but others stuck it out and say they now see signs of a recovery.
It's not like how it used to be. I can say that much.
Eugene Smith is catering manager at Venice on Vine, a nonprofit pizzeria that helps struggling OTR residents get back on their feet. He says Venice itself has been struggling, with business down 75% since before the pandemic. But Eugene is also positive about this spring and summer.
We're open and we will be glad to have your business.
He says one change that may make a big difference, the city of Cincinnati making street dining, or streeteries, permanent. Last year's ugly barricades are being replaced with planters, railings, antique sidewalks. Some Vine Street businesses, like Jean Robert's Table, are gone for good. Others, like the Mercer restaurant, are closed but hope to reopen, their website says. Tessa sees the community coming back sooner than many people expected.
I'm excited to see OTR really pick back up this summer and fall.
These bright spring outfits she has for sale, like the new flowers outside Venice on Vine, show renewed hope here in OTR 1 year after it almost ended. Small business owners say as Cincinnatians get their vaccine, they remember all the things that make this city so great and come back downtown to experience them again. Covering the rebound, John Mattery, WCPO 9 News.
We do not want to be in a situation where our medical providers are making life and death decisions of who lives and who dies.
On March 12, 2020, concern for public health and for the stress that our hospitals would face prompted Ohio Governor Mike DeWine to close public, private, and charter schools. An unprecedented step, the governor says, was needed to slow the spread of the coronavirus. Not long afterward, Kentucky Governor Andy Beshear recommended all Kentucky school districts stop in-person classes.
Not fair. If you're watching, it's not. But a worldwide pandemic has hit us, and those of you who are missing out on these opportunities, we need your help. and we need your sacrifice.
As we look at the lasting impact of the pandemic, many school leaders are saying education will never be the same. While districts tried to adapt and overcome the challenges posed by COVID-19, student learning has understandably taken a hit. Reporter Josh Bazan examines the virus's impact on students and schools and how some districts are trying to overcome that.
After 12 months of COVID-19,
we have to do more. We just have to.
Many school districts that were forced to shift to remote or hybrid learning are now trying to catch students up.
That's not a poor way of learning, but it's certainly not the only way of learning. It's not the best way of learning for a lot of kids.
And catching students up is no small task when the challenges created by COVID-19 are not going away.
We're still in the midst of a pandemic, and education has looked so very different, not only in Princeton, but just about any school district.
Pretending that these NTI days equate to an in-person day of education, we're fooling ourselves.
He's gone from like straight A's to B's, C's, D's, and F's. He has a hard time focusing and concentrating.
Some educators are calling that learning loss the COVID slide. To help address it, Princeton City Schools recently started offering free after-school tutoring sessions to students, and it is also making its existing summer programs more robust. Cincinnati Public Schools is another district that plans to expand summer learning options to help get student learning levels back to where they'd be during a normal year.
We see learning all over the place. Some students have really kind of outperformed, if you will, and other students we need to intervene a lot with. Those gaps are real, and we need to do everything we can to close them.
And while addressing those academic needs throughout a difficult year, schools have also stepped up to provide support with internet connections, take-home meals, and social services.
School as an institution is absolutely critical, not just for the academics of our kids, but for economic health, social and emotional well-being.
Josh Bazan, WCPO 9 News.
Schools are, of course, focused on academics, but mental health and the social, emotional impacts of the pandemic are also a priority for schools. As we reported in November, Mason City Schools added a team of 17 staff members to support students dealing with mental health challenges. The district says so far this school year, more students have gone through an at-risk assessment than they had all of last year. That assessment is for children who have a higher likelihood of suicidal thoughts. And Mason is not alone. The Ohio Department of Education says districts across the state are dealing with this. If you suspect your child needs help, advocates say parents should ask schools or health care providers for extra support.
Instead of layoffs happening gradually, they came all at once in a tsunami.
From schools to the economy, in 2020, when businesses shut down, workers were either laid off or forced to find new jobs. Now, a year into the pandemic, unemployment is still elusive for people across our area and the country. Widowed just before COVID hit, a Highland Heights mother found out very quickly how overwhelming life can be for a single parent amid a pandemic. Forced to homeschool, she would need benefits to make it. And her story, sadly, has been an all too familiar one in trying to get that help. You have to wonder what Robert Eldridge was whispering to his son when this picture was taken. In the months before cancer delivered its final blow to him in October 2019, he tried to prepare Preston and his bride, Mary, to do life without him.
He actually bought me a big toolbox and he would teach me how to fix certain things so I could always be self-sufficient. When he was sick, we actually arranged it so I could go back to college and receive a certificate in Microsoft Office so I could make sure I could become the main breadwinner. But we did not plan on this pandemic.
Mary has had to stay home and help her son, who has autism, learn remotely. It's a lot of adjusting for this child.
Yes, especially for an autistic child, because routine is the most important thing.
In June, Mary says she applied for pandemic relief in Kentucky, where she lives now.
I went online and applied, and it kept saying, "You're denied, call this number." I called the number would say the queue is full, your number has been saved, and somebody will get back to you. Well, that went on for about 8 months. Nobody ever answered. Nobody ever called me back.
A friend told Mary to apply in Ohio, where she and her husband lived and had a business before he passed.
I uploaded everything that they asked for. I told them everything. And then all of a sudden I get a message that's saying it's flagged for fraud.
It'd be nice to get some questions answered.
And yet you definitely, I don't understand and there's no humans to talk to.
For a single mom clinging to one of her family's final pictures, she captioned "Unbreakable." It seems like a lot needs fixing right now.
I get scared because the rent is going to go up now. Groceries are going up, gas is going up, and I'm frightened.
At our request, Ohio Jobs and Family Services is going to have a specialist look at Mary's case. This week, the department brought in a new interim leader. A spokesperson tells me he is not yet ready to give interviews on how the state is progressing. Meantime, last week, Kentucky Governor Andy Beshear encouraged people with unemployment problems to sign up for virtual interviews, but people are telling me they cannot because the schedule is full. Still to come, live events. They were the first to go and now the last to return. So what does the future hold for the entertainment industry? You're watching Hindsight 2020, the year that changed our lives. The pandemic has really taken a toll on the events industry, which has essentially been shut down since March of last year. And that was the last time any live show with a full house hit one of Cincinnati's main stages in front of a live audience. Our Evan Millward has been covering the events industry this year and shows us some out-of-the-box thinking and what changes might stick.
Since the summer, event venues have sounded the red alert, from stadiums to theaters.
Our whole business model, our whole entity is about bringing people together, as many as we can.
Live events were the first called off in 2020. In fact, many theaters are still dark, but others are starting to come back. Sporting events, weddings, funerals. So I ask those in the live events business, what changes stick around?
What sticks around, I'm not entirely sure. We know that we've done other things successfully, so we'd like to keep those as part of our arsenal.
Hamilton's Fitness Center is out of the box, as they say. Here with Cincinnati Shakespeare Company at Municipal Brew Works, and plans for other places like bowling alleys and a return to Pyramid Hill. Our major league teams are looking ahead to seasons. The Reds cleared for 30% capacity at Great American Ballpark. FC Cincinnati's ready to show off its new West End Stadium this spring, too. Capacity limits exist in Ohio until daily case counts drop below 50 per 100,000 people. The new Icon music venue is almost ready to book acts whenever tours hit the road. MEMI says it's built the space with advanced air filtration and everything is touchless.
I think putting all of these things in place are just going to benefit us all health-wise overall.
Wedding venues are booking up and fast. What sticks around after the pandemic might just be tough scheduling for a while.
So folks that are just getting engaged this year that want to have a 2022 wedding, their dates have already been taken from the 2020 folks.
The events industry and the people whose lives rely on it is still hurting.
Just being able to go to a live concert with their friends, I think myself included, had taken that for such granted that I can say with certainty that I will never take it for granted again.
At the Fitness Center, Ian McKenzie Thurley has been researching the 1918 pandemic.
One of the things I couldn't find is, when did theaters reopen?
A chance maybe for art to write history and a roadmap.
I wonder what we're going to do with this. Not just reflection, but saying to the next group of people who might not be related to us directly, it's 100 years away. 100 years later or 200 years later, this is how you survive it.
In Hamilton, I'm Evan Millward.
That's something I'd like to see, and I think the arts can be a big part of that.
WCPO 9 News.
I think that for Black women in particular, there was an impact in loss of income.
Minorities have been disproportionately affected by COVID-19 in every aspect. Still ahead this half hour, a closer look at the impact and what's being done to address racial disparities.
Me, I mean, I hated to see it, but I wasn't shocked by the disproportion.
When it comes to the impact of COVID-19 on different sectors of the population, certainly many of color have found themselves battling the virus and the residual effects. Reporter Lisa Smith looks at how the last year has impacted African Americans across the tri-state economically, mentally, and physically.
Donald Gazaway, an Army veteran and father of 4, was only 60 when he passed away in April. Odessa Williams was 82 when she died a month later. Just 2 examples of the COVID-19 victims we've covered in the last year. Victims who statistically are more likely to be Black.
Almost every person in our focus groups, as well as participating in the surveys, were able to say that they knew someone that had died from COVID-19.
RENEE MAHAFFEY Harris with Center for Closing the Health Gap says the numbers show the devastating impact COVID-19 has had on the region's African American and Hispanic communities. They released this report in January. It says African Americans died at a disproportionately higher rate than other ethnic groups in Hamilton County. Also, 52% of African Americans knew someone who died of COVID-19. For Hispanics, it was 49%.
When you start laying all those predictive factors or determinative factors, and then you look at disease burden, that was consistent before COVID-19.
Their COVID-19 CommunityResources.com website has information about everything from videos to coping help, because they found the ripple effects of COVID are stressful.
That ability to work from home wasn't equal.
But the kids were learning at home, some didn't have online access for online learning, and jobs weren't reliable.
I think that for Black women in particular, there was an impact in loss of income.
Black businesses were disproportionately caught by the ripple effect too.
Those challenges showed where you were having trouble meeting payroll, having trouble paying back loans, for instance.
Eric Kearney with the Greater Cincinnati Northern Kentucky African American Chamber of Commerce estimates 25 to 30% of local Black businesses went out of business in the last year.
They would go in and get their taxes done once a year, but they didn't have somebody to do, let's say, quarterly statements or monthly statements, analyze them.
John Harmon and his wife print marketing materials, brochures, and booklets for clients locally and across the country. But business was cut off due to COVID.
No one was marketing.
Without business from large fundraisers, Harmon had to pivot to something people needed.
Some of our manufacturers switched to masks, so we started working with them.
Large mask orders and PPE kept him going.
Contacting our customers and saying, hey, masks are required now. Can we provide masks for you?
The businesses that survived are stronger, they're better, and they have proven to themselves and to the marketplace that they are survivors and that they offer value.
Lisa Smith, WCPO 9 News.
The Center for Closing the Health Gap has a hotline people can call for questions about COVID-19 resources. The number is 513-585-5879. Our coverage of Hindsight 2020, the year that changed our lives, continues in a moment. That does it for this portion of our special. The conversation continues now with members of our community to talk more about their experiences living through this significant moment in history and where we go from here. We have an ER doc, a business leader, a kindergarten teacher, and a mom who also works juggling 2 kids learning remotely. We hope you can join us on your favorite streaming device. Hindsight 2020, the year that changed our lives, starts now online.
As of today, we've moved into a new phase of this crisis.
I am officially declaring a national emergency.
You have to start taking seriously what you can do now, that if and when the infections will come, and they will come,
This is not a drill. We need people to take smart action.
Thank you for joining us to continue our discussion about how the pandemic has changed our lives and what comes next in the fight against COVID-19. I'm Julie O'Neill. Joining us to talk about all of this are 4 people who have been affected by the virus firsthand. Not that we all haven't on some level. They are Dr. Dustin Calhoun, Medical Director for Emergency Management at UC Health, Brendan Cole, Executive Vice President and Chief Strategy Officer at the Cincinnati Chamber of Commerce, Holly Thorpe, Kindergarten Teacher at Lakota Local Schools, and Rita Stahl, Campus Director for Tech Elevator and a local mother of 2 who is working from home while teaching her kids remotely. Thank you all for being here.
Thank you.
Thank you.
Okay, wonderful. So what I'd like to do is have each of you take a minute, in just a minute, to just give me a quick debrief on what your experience is right now as we're starting to get people vaccinated, as some schools are going back to more days in person, as businesses are starting to do better. And we'll start with you, Dr. Calhoun. You actually see the patients there in the emergency room. You have a sense of what the feeling is in the ERs. What's happening?
Yes, ma'am. Right now, a lot of my effort is focused around the vaccine distribution that you're talking about. I'm working closely with UC Health's pharmacy team to get the vaccine out to the public. We know that that is the most important thing right now that can be done to move us back toward functioning as a society the way we want to, the way we're used to, or as close to that as we can get. Lots of other things going on. So that's the other aspect to the healthcare institutions right now, is trying to make sure that that messaging of that light at the end of the tunnel, that vaccine that we're distributing, making sure that we're also being firm with the need to continue with the efforts of social distancing and mask wear when we need to, and to recognizing that light at the end of the tunnel really is still a distance. It's very reassuring, but distance.
The feeling, Dr. Calhoun, in the actual hospitals right now, are they packed with patients, or is it eased up? Where is our level of stress on our doctors, our nurses, our staff in hospitals? Is it getting better?
It is getting better right now. We have seen recently a plateau of the decline in patient numbers that we've been seeing over the past few weeks to a month or so, with a little bit of indication of possibly increasing even. So there is that aspect, but right now we're not seeing anywhere near the crowding we were seeing a month ago.
Very good, very good. Okay, let's move to Brendan Cole, Chief Strategy Officer at the Cincinnati Chamber of Commerce. Let's talk business. You go talk to any restaurant owner or manager. Their business is way down and has been, those that are still open. Is it getting better? What are you hearing from them, from other businesses, in terms of where we are in recovering 1 year after we called this thing a pandemic, or the World Health Organization recognized it as such?
Julie, thanks for having us. You know, the Chamber represents 4,000 businesses all across the region, and I can tell you we're in touch with many of them every day. And what I can tell you is actually there's a pervasive level of optimism right now. People are excited about what they're seeing with the vaccines. They're getting the vaccines, their friends are getting the vaccines, their customers are getting the vaccines, and they're starting to think about people coming back. And, you know, as I reflect on the year, what I think about are, business owners who innovated, who thought of new ways to serve customers, and who made it through the year. And sure, we lost some restaurants and we lost some businesses. It's been tough on a lot of people, but this is a strong economy. The jobs are coming back. They're finding new ways to do things, and I think that that's what you're going to see this summer is a pretty impressive. It's going to feel like it's going to feel like an incredible summer when people feel like they can start doing things again.
Yes, I'm feeling it already, seeing neighbors and friends who've started getting vaccines and wanting to go out and see each other more, and it seems like there's something happening here. All right, Holly Thorpe, you are a kindergarten teacher with Lakota Local School District. I know you must be hearing it from these little ones, how things are impacting them, noticing perhaps changes in them, as well as hearing from parents. What has been your experience, and where are we now?
Currently, we are in a fantastic place. Lakota has had the opportunity to be in person 5 days a week since August, with the option of virtual learning. Some parents have even chosen to take their students from virtual learning and enter them back into in-person classrooms, which is an amazing feeling because as a district, you feel comfortable that your parents see that you are creating a safe environment for your students.
And so let's talk for a moment about, now your kids have been back for some time now. What I hear from those who are still struggling is not just the academic, and we saw in the first half hour here how, you know, the COVID slide and how it's impacted kids' grades, and very close friends of mine have seen this with their kids, namely with the middle schoolers and high schoolers, which are older than the students that you have. How on earth do we catch them up? What are we going to do here to catch them up and address the mental health issues? That's a big question for you, but I'm going to let you take it.
That's where we're at now. When we started in March, it was a lot of confusion and it was a fight or flight situation, and we chose to fight and do what was best for our students. And we have to continue to do that. We do a lot of things throughout the day that many parents aren't even aware of, that the average person isn't aware of. We do more than academics, as you mentioned, the mental health of our students, the well-being, the holistic well-being of our students. And that's where we're at right now, trying to figure out how this past year is going to affect them in the future. And what steps do we take as educators to help them with that, socially, emotionally, mentally, and academically especially.
Right.
So we're in the problem-solving phase, essentially, to answer your question with that.
Yeah. All right, and from there, let's go right to Rita Stahl. You're a mother of two, a working mother from home. You've been trying to help your kids learn remotely, and so you're seeing, and I, you know, obviously I don't want you to divulge their, you know, anything private to them, but we talk to other moms and dads and see what's going on with kids. What is the sense that you have about the emotional toll on children and how they're having to learn differently and the pressures there?
Yeah, and I so respect the teachers, so I want to throw that out there. This has been a very difficult year. My children launched in 2015 or last year and went fully remote, and my kids have been mostly fully remote for the entirety of the year. They've only been in school a very couple of days. They're in CPS right now, so there's a light at the end of this tunnel. They're going to be going back 5 days a week here in a couple of weeks, but it's been a rough year. I have a kindergartner, so I respect our teacher's perspective here, who this is his first year coming in, and he doesn't know what school's like. So his whole exposure to school now has been solely on an online learning platform, and it's really just not the same for him. And I do have a second grader as well, and it has been a challenging year for him. He has some learning disabilities, and it's difficult for me to manage my kids' schoolwork, their different meetings, their different teachers, and doing my full-time work as well when I'm on a Zoom meeting 6 to 7 hours a day as well. So it's been a challenging year.
It's a lot of screen time for all of us, for sure. And then, you know, when we talk about, I keep harping on this because I just have heard so much of it from people around me. Someone told me today that he knows of a 7-year-old dealing with depression. And how on earth do we address it? I'll ask you, Dr. Calhoun. I know you're a medical doc, but certainly when you deal with patients and families and you have some background here, you know, what do we do about these kids that are having severe mental health issues?
Well, mental health is a constant struggle in our country, even before COVID, particularly mental health amongst children. It's something that has continued to attempt to be addressed, but never fully addressed, and COVID has certainly not helped that. Certainly the isolation aspect, as was mentioned by at least two of the other guests on the show tonight, there are some tremendous aspects of schooling just that are socialization, far beyond just knowledge acquisition. There are aspects of mental health that come from that. And trying to find alternatives to that, especially in the short time span that's been provided to do that, is extremely difficult. There are some resources out there, and then just being as creative as possible and being as open and honest with the children as possible, and open and honest with your healthcare professional as possible, where that physician, that psychologist, that psychiatrist that you or your child may have really does need to know what is going on in order to be able to try to provide guided and individualized help with those situations.
And so let me switch back to the medical for a second while I have you, Doctor. You talked about vaccines, and that really is the key to getting us all back to some normalcy. I'll tell you, as a 50 and older, I signed up today. I had no trouble scheduling an appointment, so feel good about that. I know you've been working hard on that piece of it. And so for those who are getting the vaccines, any sense of the number of people that are having really adverse effects? Because I don't know anybody who's had really bad ones.
Very, very limited. So, of course, as an emergency physician, my version of really bad is different than some other people's version of really bad. But even the really uncomfortable side effects are very minimal. We're talking limited periods of time, limited amounts of effects, absolutely nothing that should defer anyone from getting their vaccine. The numbers are tremendously small. In the 30,000 plus doses that we at UC Health have given out, we have seen less than a handful of patients that even really needed to be secondarily evaluated, and none that had any severe reactions.
All right, let's do this before we go any further with the questions that I have. I'd like to give each of you a chance to tell me something from your unique perspective that you feel like those who are joining us right now maybe don't know, or you feel strongly they should know, that you want to share. And we'll start with you, Dr. Calhoun.
I think it sort of goes back to the light at the end of the tunnel analogy that I keep using when I talk to people. I think it's important that we have hope, and that we don't suppress all of the joy and the happiness that's coming from the situation that we're producing with the vaccine. But I do want everyone to realize that we haven't gotten out of the tunnel yet. And while the light keeps getting bigger and bigger and closer, there are still plenty of places to trip along the way. So we do need to continue taking care of ourselves, taking care of each other, and not take the chance of losing all of the ground that we've gained through all of the work and suffering that individuals, not just in healthcare, but all individuals in society have put up with for the past year. Small slips can lose a lot of ground there. So we want to, as much as we can, stay the course right now as we get through some of these unknowns, the new unknowns in the system, such as how are the vaccines going to be affected by the variants? How are the variants going to affect us? I think that's knowledge that people need to really gain for themselves to be able to make informed decisions about some of the new liberties that are being provided by some of the softening of rules around us.
Okay, very good. Brendan Cole, you are up next. What is the main thing you want to make sure gets said tonight from your perspective?
Well, first of all, I want to thank Dr. Calhoun. I mean, anybody who is working to get vaccines out is doing the right thing. And if I can get a message out, every single employer is ready to get things back to normal. They want to keep people safe. They're telling people to wear masks still. And they're also encouraging all of their employees to get vaccines, because that's how we're going to get through this. But what I want people to think about this year is that we got through this together. We got through this as friends and neighbors helping each other. You saw people supporting their local business districts in ways that were really incredible. And so when I think about our region, the Cincinnati region, Northern Kentucky, I think about a community that came together to help each other, to help support small businesses. You know, when you couldn't go eat in a restaurant, people were doing carryout because they just wanted to support their friends who owned that business or who worked there. And I think those are the things that I'm going to keep with me. This has been a trying, tragic year. And, some of these stories reminded me of some of the really hard moments. But what I'm trying to keep front and center are the moments where we came together to support each other this year, and there were lots of them. And this year, 2021, there's going to be even more. It's going to be a year where we feel like we are just all together, united again, and we're excited about what's to come.
Yeah, let's hope for that. Okay, Holly Thorpe, you are up. The perspective of a kindergarten teacher or teacher in general, what's the main thing that you want to get out right now?
I think from both a teacher and a parent aspect, the important thing is that I know it can be difficult sometimes it can be inconvenient, I should say, to switch from the virtual model to the in-person model, or if you are currently doing the all virtual model, you may find it inconvenient. However, you have to stop and think that we are only trying to do what is best and safe for our children. I know as a mother who has a child in a different district than I teach in, that was one of my biggest issues this year. He was in and out of virtual. I was in person consistently, and although it was inconvenient, I knew that they were attempting to do what was best for children.
Okay, thank you. And Rita, you mentioned that how grateful you are to the teachers now that you're having to do their job at home. Like so many, my sister has triplet boys, so you can imagine first graders, how fun that was for her when all this started. And there are just so many stories, and it's a lot. It's a lot. And do you have? Is there something you want teachers to know or other parents to know? Something from your perspective you want to make sure gets said?
Yeah, I think for this year, for all that COVID's done to tear everybody apart, it's definitely brought us a lot closer together. And I've appreciated the time I've been able to spend with my kids and watch them grow up this year in a way I've never been able to do before up to this time as a full-time working mom. So I appreciate everything the teachers have done in this model and going forward between hybrid and going in person and everything to ensure the safety of our kids. And I know for certain my kids are so excited to go back and be with their teachers full time. So I appreciate everything that's being done on their end to make that possible.
Okay, we have about 10 minutes, and I'm going to use every nickel of this this dollar because I have experts here. Brendan, I want to go back to you. I had someone message me on Facebook. He's a small business owner, and he said that the federal government was now going to give them 2 months of grace on these loans instead of 3. I don't want to misspeak, but basically some of this loan forgiveness is not happening as one would have thought or one was led to believe. Are you hearing about these kinds of things, struggles for businesses in terms of the catch-up that's needed to get back, back in the black, so to speak?
You know, one of your guests earlier mentioned in one of the segments about, depending on how big your business is how sophisticated you are at filling out these forms or what you have ready. I'd love if you, Julie, send that person to me. I'd love to help them. We do that all the time for our members. It's really important. But what I can tell you is our region got $4.6 billion of relief in PPP funds. It supported more than 500,000 jobs. It's almost 40% of the jobs in the region. And what we heard from folks, because we worked really closely with banks and with businesses to put them together so that they could get access to those PPP loans, that was the lifeline for many of these businesses. And without that help from the federal government, I think you would have seen this be a lot worse. 7 out of 10 jobs are back in Cincinnati. And so we're seeing that recovery here, which is good. Hopefully it'll keep going fast over the course of this year. But I'd love to talk to that person who's having trouble, see if we can help them out.
Yeah, and you saw in the first half of our special the issues people are having with unemployment benefits, and it's not everybody. Some people are filling it out and they're getting those checks, and it's been great, and there's much to be said for that. But there are some who for their lives cannot get a nickel, and they're getting bounced around. And conspicuously absent from our panel tonight is someone with the unemployment system, but they're buried in it right now and trying to get the wheels turning faster in their defense. and I'm hoping to get an interview soon and find out where we are. What are you hearing? And I'm going to stay with you, Brendan, about those issues, about employment and the help coming for people who are not able to get these benefits.
Well, we're hearing more and more. I think the relief bill that was passed yesterday, something that we advocated for, will be helpful. It includes additional stimulus for individuals and families. That'll be a good thing. It is an interesting story. I'd urge you to keep with it on the unemployment benefits. There's been a tremendous amount of fraud. Obviously, that's not the government's fault. There are hackers who've tried to steal money, and we've got to get that under control because it takes away from an individual who needs it. But I think the stimulus should help people, and hopefully it'll help give a boost to the economy this spring and summer.
Yeah,
they say that the checks are apparently going to start arriving as soon as this week, and that'll be a big help, I think, as businesses get back up and running too.
Very good. So are we talking about, in general, small businesses are going to be getting checks this week?
Well, individuals. You were asking about individuals.
Individuals.
So the stimulus
Okay.
check. Yeah, exactly.
Right. Yeah. If they're signed up correctly, and that's
Right.
part of the issue. I did a piece a couple of weeks ago about the Ohio Business Roundtable, and its CEOs coming together saying, what can we do? And now they are partnering with the state to fix the system as best they can. And again, the wheels are turning, and the head of the Business Roundtable said, Julie, people will be made whole. It's just going to take time. And that was encouraging, and he spoke with some authority there. It's just that it takes time, and it seems like, and I'll ask any of you that want to comment on this, it seems like in the last year, if you lost your job or if your business took a slam from this, if you couldn't get those benefits, you better have family that can help you, or real good credit to borrow, or you're in line trying to get a box of food and figuring out where you're going to live. And that, I think we saw that up close and personal.
Julie, I don't want to take too much time, but what I would say is that the generosity of the businesses and governments here locally to take care of people was unbelievable, whether it was loan funds from Duke Energy, which helped some small businesses stay afloat. Procter & Gamble and Kroger partnered to help individuals in need with the United Way Fund and the Greater Cincinnati Foundation Fund. There was so much generosity in taking care of each other this year, and that was the only way that we were ever going to get through this year. I feel fortunate every day to live in a community like this where we were able to band together. And sure, some things didn't work well. Your program is called Hindsight. And if we could have fixed everything a year ago, we would have. But what we saw here was really a triumph of our community, and it does warm my heart to think about how well we all worked together to get through this year.
Well put. And we have our Acts of Kindness series here at WCPO 9 because there's been so much of it, and it restores the soul to see that kind of beauty in times such as these. So let's, you made a good point. Before we go, I'd love for each of you to share with me, if you could tell yourself a year ago, what to expect, knowing what you know now. What would you tell Holly, what would you tell Holly a year ago about that might have helped her through this past year?
You're going to learn more in the past year than you probably have in 4 years of college. The problem solving and flexibility and quick thinking of not only myself, but my colleagues, the parents that I work with, and the students that I work with was amazing. It was an incredible year.
Yeah. What a beautiful thing. You learned so much. Okay, very good. All right, Holly did the hard part going first. We'll go with Rita next. Rita, what would you tell Rita a year ago?
Yeah, I'm so incredibly grateful to work for an organization and a company that has balanced our work life effectively and allowed us to take time to support our kids through all of this schooling. So it's been an incredible experience to be in a situation that I was afforded to me to be able to do and juggle both of these things at the same time. And then if I had to look back for the whole year, I would just say, like, just take a deep breath every day. Like, you're going to make it till 2 o'clock with those kids, and then you're going to be able to put them to bed and focus on your work in the afternoons and evenings, and you're going to get through it just fine.
Very good, very good. Yeah, we step up when we have to, right? Okay, Brendan, you're up next.
You know, I might have gotten my bicycle fixed a little bit earlier in the year. It was tough to get that done. But you know what? I liked that take a deep breath. I mean, I found this year it was incredibly stressful at times. I think if I could go back and tell myself, it would be to find more times just to call people and check in, even to see how people were doing. I don't even feel like I did enough of that this year. I tried to do a lot of it. But there are people that you bump into on a day-to-day basis that I miss, and I'm looking forward to seeing again.
Absolutely. All right, Dr. Calhoun. Boy,
yes,
it's a mouthful for you as a doctor.
No, I'd have to say two things. First, I tell myself to stop stress eating, and that's probably good advice for everybody. But the more important thing is that I would tell myself that there's just absolutely no way that you will ever believe now how proud of where you work, who you work for, and who you work with, that you will be a year from then. Just working for an organization at UC Health that has contributed to every single part of this process, from the research for cures, research for vaccines, to the being prepared for massive amounts of patients if we had those, to getting the vaccine out there, and just watching an organization that it has financial problems as well. There were times when the healthcare institutions here were losing tremendous amounts of money, and just watching that be entirely ignored in order to deal with what the public needed in dealing with the patients, and then just seeing colleagues who, for many, in the first time in their career, the risks that they were dealing with weren't just risks for their patients, they were risks for themselves. Seeing healthcare providers day after day realizing that they were putting themselves at risk going to work, much more so than they ever thought they would, and doing it anyways, and not questioning that for 1 second, but just watching those colleagues and working for that organization. There's no way a year ago that I could have possibly known how proud of that and how impressed by that I could possibly be.
Yeah, this whole thing started, Dr. Calhoun, with this. We don't want our doctors and nurses, number one, to have to do this without proper masks, without proper PPE. That was the first thing. And so the level of stress for our nurses and doctors was just through the roof. Where would you say the level of stress is now? We got about 20 seconds.
Lower. The institutions and the government have done tremendous things for providing the PPE and the knowledge that we need to use it appropriately. So there's definitely lower stress. Not none, but definitely improved from where we were.
And I agree with the panel. Thank you, Dr. Calhoun, for the leadership role you've taken and keeping us as healthy as we possibly can be. And please thank your staff, and to each of you. That is all the time we have for now to talk about how our lives have changed in 2020, but we thank you, our guests, for taking the time to speak with us tonight, and I thank you for tuning in. We want to mention that this entire special will air again this weekend on our streaming channel at 2:30 p.m. and 9 p.m. Thank you for watching, and good night.